Novella, who's going to, I think, introduce the topic and read Kathy Russell's paper.
Yes, that's right. Okay, thank you. Well, as you will see on the program, I originally was given the honor of introducing Kathy, and so I am in fact going to do that, and then I'm going to read an edited version of the paper that Kathy sent to us. And just to say, she texted me this morning and said, look, make sure everybody knows I'm okay. She unfortunately picked up Lyme's disease a few weeks ago in the States, but actually that is completely, that's curable, it's been detected, she's on heavy antibiotics, but she's just, it has an effect. So I want you to know that. And I want to just start by saying a few words about Kathy and her research, and I'm going to guess that for many of you, she doesn't need a lot of introduction, but she's been she's been a spirit behind Novella, but also behind our Center for Narrative Research. And it was a real coup on Anne's part that she got Kathy to come and to be a keynote speaker for us. And of course, it is really disappointing that she isn't here. And I hope I can do justice to her really very beautiful and thoughtful paper. I'll try to do that. A little bit of background about Kathy's own biography. She is a research professor in the Department of Sociology at Boston College. She's also an emeritus professor at Boston University. She has been for a long time a visiting fellow of our Center for Narrative Research. And what's interesting, and keep this in mind as you hear this paper, is that Kathy's PhD was in fact in socio-medical science from Columbia. Okay, so that's her original orientation. And she's authored a number of books, but perhaps for many of us, the one which marks, or at least for me, let me put it that way, but I wouldn't be surprised if I'm not the only one in the room, the one which sort of sets her apart, it was her publication in 1993, what Kathy calls the Little Blue Book, called Narrative Analysis. 79 pages long, but what a punch, okay? And I think many of us have used this work for many years. And then in 2008, Kathy wrote a much, much more expanded book called Narrative Methods for the Human Sciences, which, by the way, is going to be for sale, I should mention that, in the Research Methods Festival. That's a really wonderful book which actually brings together a huge array of questions relating to narrative research. But I think that for many of us, it's this little blue book which really sort of set her apart. What I want to do is just make sure that I have some water here, because I'm sorry you're going to have to listen to me read a lot. And so here we go. Kathy, obviously this is written in the first person, so, and she entitled it, Writing to Get Through It. Can you hear in the back, by the way? Promise me, just put your hands up if I sort of sink into being too quiet or something. Writing to Get Through It, Narrating Cancer. What could I speak about that would be appropriate to the novella theme of everyday life? My work in narrative over the past 30 years has been concerned with ruptures in the everyday. Aristotle, the ancient philosopher, was the first to theorize that dramatic plots turn on ruptures. Something goes awry. There's a breach in the expected course of things. In contemporary medico-centric culture, those moments are often called trauma. Imagining a talk, I found myself thinking about what happens to our taken for granted ideas of time with a rupture. I thought about my experience over the last 3 years for reasons that will become clear shortly, when my awareness of time was magnified. Could I craft a talk that worked over the experience analytically in relation to meanings of time? I wondered how my shifting audiences over time shaped the various versions of my story. Time and audience. Perhaps I had the conceptual makings of talk here. I stepped into this debate with an experiment in blurring genres, entries into a journal I kept during cancer treatment and the construction of, subsequently, of a story about my illness experience. I call the raw material a, quote, chronicle, adopting Hayden White's language, because it records the events but lacks analysis or much interpretation. At points, my journal became reflective. At other points, it simply lists particular events and medical procedures. In this talk, I draw from the chronicle to compose an illness narrative that configures an integration out of a succession. The idea that someone would construct a story from unexpected health events is hardly news, nor is the increased importance of time. It is omnipresent in the thinking of the seriously ill. In health studies, the illness narrative is now a familiar genre, and several sociologists have written autobiographical accounts to reflect on their illnesses. Some scholars have focused on the narratives therapists develop and enact in clinical encounters to reconfigure time for patients trapped in their disabling present contexts. The patient's narrative begins, of course, before such encounters can have their healing influence, often at a time of diagnosis or with the first symptoms. But not all illness narratives begin at the beginning, and temporality is not necessarily linear. Illness, by its very nature, disrupts temporal continuity, for it lacks a coherence that permits us to, quote, see the end in every beginning. Personal narratives, Mark Freeman notes, rarely display, quote, a tidy flow of meaning from beginning to middle to end, nor are they so demarcated structurally. Beginnings. My experience of illness didn't have a clear beginning in time, and as I came to write about it, temporal ambiguity only increased. Unlike many patient stories that begin with pain or discomfort that won't go away, the discovery of a suspicious lump or a loss of consciousness, my illness had an insidious onset. I didn't realize anything was wrong until my physician used the word, quote, mass, to describe a bump on my thigh and ordered an immediate MRI. Without pain or any other sign, illness remained an abstraction. It's not surprising, therefore, that the first entry in my journal harks back to memories of a typical day. 3 miles on the elliptical machine at the gym, lifting free weights, lots of stretching. My body felt strong and powerful, but the day did not end typically. I came home from the gym to pack a suitcase to take to the hospital, where I was to start 24-hour infusion chemotherapy the following morning. The beginning I chose for the written chronicle embodied an abrupt rupture in my everyday life. It thrust into consciousness the reality of my changed citizenship. As Susan Sontag wrote, we all hold dual citizenship, quote, in the kingdom of the well and the kingdom of the sick. Although we all prefer to use only the good passport, sooner or later, each of us is obliged, at least for a spell, to identify ourselves as citizens of that other place, end quote. My journal was begun in January 2011, a month after the diagnosis of soft tissue sarcoma. But where to begin? Like all diarists, I searched for words and for a starting point in time. After recounting my day at the gym and entry into chemo on January 2nd, 2011, I wrote, should I back up and begin at the beginning when I first noticed a bump on my right upper thigh? It looked like an overdeveloped muscle. I had worked hard in my physical training to strengthen my other leg, which was definitely weaker. A dermatologist doing a routine skin cancer check 2 weeks ago had passed over the lump, directing our conversation instead to techniques for preventing skin cancer, sunscreens, and proper hat. Analytically, I wonder now if this is where the illness narrative will commence. Is what I wrote in the journal a proper, quote, beginning? Or should it have started several weeks later in time when a physical therapist suggested I see my doctor, who in turn referred to the bump as a, quote, mass, and arranged for an MRI the same day, reflecting my access to barrier-free medical care as a member of a privileged class in the United States. For the dermatologist who overlooked the mass, her story might begin with my heightened risk for cancer because of the extent of sun exposure from my years of sailing and kayaking. Or does the story really begin decades earlier with the genetic mutation that ruptured my body's cell division process? Among these different temporalities, whose timing is most important? Where narrators choose to begin a story is located in the particular time perspective of differently situated narrators. So too does the, quote, point of a story represent perspective. The story means different things to different participants. For oncology geneticists, I could not escape a genetic destiny given the family history of cancer. They would begin the story of my illness with a genetic predisposition, activated perhaps by an environmental exposure. The physical therapist that got me to the doctor would begin her story with an observation. What was for me an overdeveloped muscle in one thigh meant something else to her. But this is my story, and where I choose to begin it is significant. All narrators struggle to find a starting point for a story, and the choice can seem arbitrary. I chose to begin my cancer journal by recounting a rigorous day at the gym, a typical day in my everyday life, followed by packing a suitcase to go to the hospital. Why begin there? My choice invites interpretation. Juxtaposing two contradictory events epitomized rupture and incoherence. Looking back, I think I also began where I did because cancer assaulted one of my prized identities, a physically active woman, the picture of health, who during the year before had camped and hiked in New Zealand, Tasmania, taken Zumba classes, worked out regularly at the gym. The beginning I chose also challenged widely held beliefs in the popular medical press about cancer prevention, which as a culture member I totally shared. Advantaged by class position and excellent insurance coverage, I had obtained in the previous year all recommended cancer screenings, a mammogram, colonoscopy, dermatology skin check, dental exam. I wore seatbelts and a bicycle helmet, ate mostly vegetarian, didn't smoke, drank in moderation. This could not be happening to me. Clues are contained in narrators' choices of beginnings, especially the conflicts and tensions they anticipate. Although I didn't realize it as I was writing, the beginning I chose erases temporal divisions. Past, present, and future are all packed into the suitcase episode. The beginning pivots on contradictory events, working out, packing for a hospital stay, a rupture in the routine of everyday life. I had studied ruptures in the lives of others throughout my career. Divorce, chronic illness, infertility. Now the tables had turned. Middle. If the beginning is ambiguous, so too is what followed. How would I identify the, quote, middle of my illness narrative? Temporally, it would have to include the long slog through treatment, the chemo disaster, daily radiation for a month, surgery, and months of rehabilitation. There are also brief forays into the kingdom of the well that I wrote about. To construct this written illness narrative from the unruly jumble of experiences, only some of which were even chronicled in the journal, I made choices. Diarists don't write about everything. They choose what to include, which characters to give leading voices to, what to ignore. These choices, in turn, contain clues for interpretation. As the analyst, I now ask of my journal, what is enumerated and emphasized? What is minimized? What events and which characters are given the most time in the text? Who were my imagined audiences? Pages and pages of my cancer journal recount moments with particular health professionals, few of them doctors. Most important in my care was a radiation therapist, Barry, an occupational therapist in the rehab hospital, Anita, and a series of physical therapists. The hopeful environments they created by their actions takes up pages and pages of my journal. Work with these therapists devoured time. As I now interrogate this new everyday life, being a cancer patient, I, quote, descend into detail. Looking back at the pages of entries in my journal on the radiation center, I see how I enjoyed the positive mood of the place, how difficult it might have been for staff to sustain. The environment provided a way to take a momentary vacation from my identity as a cancer patient and take up another identity, more in keeping with my everyday life, medical sociologist. As people in my occupation do, I observed and wrote things down. The cheerful way the radiation staff greeted patients, the organization of the space in the waiting room, the talk between patients that produced an instant commonality, and the respect patients showed to those who didn't want to talk. Paradoxically, in this quintessential unit of the kingdom of the sick, we patients could perform our other selves. Leaving the radiation unit turned out to be harder for me than anticipated. After 28 days of treatment, I wrote, "Why am I feeling so weepy? Yesterday and today, I realized I won't be seeing Barry, Abe, Tiffany, and Ashley, the radiation technicians whom I visit and joke with every morning. They have become my healing community during the last month. I will miss their cheer and the predictable routine they give to my day. I have come to care for these people who have cared for me." Although the kingdom of the sick was hard to leave, my foray into an alternative kingdom was not without its tensions and contradictions either. I have been home for, this is a quotation from her journal, "I have been home for nearly a week. Memories of my radiation tech friends have been replaced by time with Glenn and the everyday routines of homemaking. How comforting it feels to be ordinary again, a woman keeping house with an occasional foray into email life, declining requests to review manuscripts, responding to drafts from a student, stalling on requests for talks. My academic identity has definitely receded in importance. Now I plan my day around food, laundry, trips to dump, and post office. Earlier in my life, I thought of these activities as burdensome, aspects of the prison house of women's domestic role. Now they give me comfort. What does my enthusiastic embrace of this domestic identity mean for my feminism? Is it the familiarity, the ease of habitual routines that comforts?" End of quote. Perhaps the pleasure in domesticity is connected to what awaits me in the near future. Surgery on March the 2nd, a week in the hospital, a rehabilitation hospital afterward, and finally home, but to a hospital bed in the living room. None of this will be ordinary, hence my enthusiasm for the ordinary now. Looking back now at the entries in the journal during this, quote, middle part, I notice a subtle shift in voice and in the shape of entries, related, I think, to the evolving audiences I imagined for the journal as it progressed. I had begun the cancer journal for myself. An intimate diary provided a place to record the bare facts, the procedures I was enduring, quote, "Today I got a catheter." And it served as a refugee for feelings, fears, and frustrations. I want my body back. I didn't want to burden my family or close friends with the dark side. That's one thing a journal is for. And writing continued, the imagined audiences for the journal began to expand. New purposes for it emerged in my mind. I wanted a personal record that could be read by my children if things didn't turn out. I wanted a record that I authored and controlled, a counter-narrative to the context-stripping medical record. During the month of radiation treatment, I now see I use the journal almost as if it were a place for field notes, my interpretive voice as the medical sociologist increased in volume. When I was an inpatient in the chemo unit and later in the orthopedic surgery unit, writing was a way to withstand the empty duration of hospital routines. I could still invoke my still vigorous mind, maintaining an observer's eye. I could critique hospital practices, relating observations to concepts in the literature. I remember thinking perhaps I could use these observational notes in teaching someday, forging a link between the present with past and possible future in the classroom. The journal might even be a resource for a professional paper on illness narrative, if I could figure out how to do such a paper with scholarly merit. Around this time, an invitation came from a former student to give a talk at a conference of occupational therapy researchers. Thinking about an appropriate topic, I realized I had to write about the illness experience. In sum, my journal was anything but personal and private. There was interrelationality, a consciousness of others throughout its writing. The imagined audience for a written document can shift over the course of its production. My cancer journal started for one purpose and evolved over time into something different. The story I eventually composed from the journal has also been profoundly shaped by imagined audiences. In choosing to reveal these shifting motivations over time, I hope disclosure alerts interpreters of written documents, especially postings on the internet, to proceed with caution. Written documents do not give us access to, quote, authentic experience or an essential self. They are always mediated by audiences, real and imagined. As Susan Sontag wrote, it is superficial to think of a journal as a, quote, receptacle of one's private, secret thoughts, like a confidant that is deaf, dumb, and illiterate. In the journal, I do not just express myself more openly than I could in person. I create myself, end quote. Not only were others with me as I was composing my illness narrative, I think I was also dimly aware of the transformative aspect of writing. This is how I want to be known. Returning to the sequence recorded in my journal, by mid-March the surgery was over, leaving in its wake a 15-inch scar stitched together with 68 metal staples. In my journal I asked, how could a small bump necessitate such a long incision from knee to waist? I stared at the long scar in my thigh, a bodily marker of rupture. I want a record of this one and asked Anita, the occupational therapist at the rehab hospital, to take a picture of it, thinking I would put the physical evidence in the journal. Perhaps a visual image will remind me that I still have a leg. Not so long ago, the customary treatment for my cancer would have been amputation. In the rehab hospital, the work began to get some function back into the leg. A world of occupational therapists and physical therapists filled the relational and temporal void left by the impersonal surgical service, and their knowledge guided my recovery. As I read through journal entries now, I see embedded mini-narratives that contrast with the listing of procedures in the earlier entries. On March 16th, I wrote the first of a series of reflective entries. Quote, I learned this morning how to put a sock and shoe on my right leg despite 15-inch scar, 68 staples, and massive stiffness. I love the grabber, long shoe horn, and the little tricks Anita taught for getting in and out of bed. She imagines me at home next week and has forced me to think through handling toileting and dressing independence. She's ordered a hospital bed and has a future in mind for me, in sharp contrast to my fixation on the present and the past, getting my thigh muscles to fire up again and wondering how I got cancer in the first place. End quote. Writing, I realized later, was my job as a sociologist, chronicling what I see and hear and making sociological sense of it. The, quote, middle of my journal continues with pages and pages about my work with each of the occupational therapists and physiotherapists who became the objects of my affection. The middle of my journal is a kind of pastiche, the bare facts and key moments detailed in mini narratives, some connected, others not. Temporality is at odds with clock time, for the journal is riddled with gaps. Like all diaries, mine recounts the incidents I chose to record. It is not a literal or even a full record of the visceral experience. The distinction between the illness experience and any narrative writing or speaking about it is important. There is sometimes a tendency to conflate the two levels in narrative research. To construct a paper from my written journal for this talk, I selected sections that describe the healing actions of a variety of health professionals with whom I worked. By the choice, I pass over the actions of the oncologists and nurses who might wonder about my representation. Their stories about my illness would clearly be different. Instead, I feature the actions of radiation, occupational and physical therapists, subordinated health workers, typically missing from stories of illness. Through minute actions, they inscribed a future onto my present, to which I, after much kicking and screaming, became committed. I could then become a partner in my own recovery. Working together, we reconstructed time. Endings. Where does my story end? For oncologists, a cancer patient is forever in remission. Any sarcoma story is ongoing because of the physiology of the disease. For them, I will always be, quote, at risk. My past is inevitably inscribed onto my future. Although I have resumed all the activities of my prior life, the 3-month and now 6-month checkups at the sarcoma clinic continue to unnerve me. However it turns out, my life will never be the same. I will forever, quote, hold dual citizenship in the kingdom of the well and the kingdom of the sick. But my illness experience longs for an ending. Constructing a story that can end has been a coherence-seeking project. Deciding to write it all down has lent a degree of order to the jumble of events and emotions of the last years. But like others with chronic illnesses, there's an absence of a clear temporal horizon that can lend meaning to what has come before. However illusory any, quote, real ending might be, individuals do finish writing their stories. I certainly wanted to get mine over with. On June 9, 2011, I decided to stop keeping a cancer journal, making the following entry. Today is the 6-month anniversary of my cancer diagnosis. The doctors at M say I'm doing superbly and the scans are clear. Thanks to hard work and physical therapy, I have semi-functioning quadriceps again. I was able to hike with Glenn in Maine a few weeks ago, not the difficult trails in our guidebook, but we did hike one moderate and several easy ones. My hairdresser has shaped the curly fuzz on my head into something stylish. I've packed away my wig to give to another bald-headed woman, yet to be found. But perhaps the wig should lie in waiting for me. Who knows if this is the end of my slog through cancer? End quote. As it turned out, I ended the journal too soon. In November of 2011, a chance x-ray in an emergency room for a broken rib suffered on a hiking trip revealed a suspicious nodule in the other lung, the most common site of sarcoma recurrence. Reluctantly, I reopened the journal file and wrote 3 more entries. The first, after receiving a phone call from an oncologist at M, he said, "The mass in right lung is likely metastatic sarcoma." He was scheduling an appointment for me with a surgeon. The second entry was about the devastation my children were feeling compared with my acceptance. I wrote, "I knew it would happen eventually, but why so soon, and when I feel so well?" The third brief entry was recorded on the day of my brother's death from metastatic cancer. Quote, "I wish I had time to mourn. I'm packing again for the hospital, lung surgery this time." There was no time to write more. As it turned out, everything was fine. The mass was removed, it was not malignant, and I was back at the gym 10 days later. The lung experience subverted the neat ending I had found for my journal, instead constituting a new beginning, lung surveillance for the next 5 years. I was reminded of William Faulkner's wise words about time. The past is never dead. It's not even past. Conclusion. In my talk today, I took sections of my journal about a memorable period in 2011 to compose an illness narrative that I hope raises questions about assumptions circulating in narrative research about time and narrative. The tripartite structure adopted to organize the talk provided an easy and familiar form, but I tried to trouble the borders and the coherence they imply. Temporality is ambiguous. Beginnings, middles, ends bleed into each other, just as past, present, and future do. Clear divisions erase the continuing, durative nature of a chronic illness and a life. Clear divisions certainly were not present in the flow of this storyteller's life, even if temporal categories proved useful in writing an illness narrative and giving a talk. Finishing this version of my illness narrative, coupled with things I've learned along the way, has made me deeply question taken for granted ideas about time and narrative, including some in my own previous work. Narrative scholars for decades have said narratives are typically structured by time. That is, they are temporally ordered. Even in an earlier paper of mine, I began to question this belief. Our lives are messy, and we should expect the stories we collect about them to be messy in turn. Quoting Mark Freeman. It's also true that the narrative impulse is an effort to bring order, to say it began here, and then, because of this, that happened, and this is how the end connects to the beginning. Composing an illness narrative provided a way for me to force some kind of order onto the flow of my experience over the last 3.5 years, even as I became acutely aware, as I was doing it, of the illusory distinctions of the past, present, and future, beginning, middle, and end. Writing for all of us is an act of creative imagination, but it doesn't come from nowhere. Primary for me was the category of time, which I tried to unsettle from its modern footings, unidirectional, linear, clock time introduced during the Industrial Revolution, and from the past, present, future, or beginning, middle, end categories of narrative research. Time is a force in nature, but it is we humans that parse it into seemingly objective categories, which we then take to be real. By looking at the subjectivity of my being in time during a major illness, I tried to trouble everyday temporal categories. Our narratives about ruptures are unique in ways that tend to blur customary temporal boundaries. Other events are easier to narrate, perhaps, Ask me how I met my partner and you'd get a temporally ordered, coherent story, a very funny one. But not all human experience is so amenable to the narrative impulse. Survivors of extreme trauma such as war and torture have taught us that rendering such raw experiences that defies understanding into a connected story lends experience a coherence that it does not possess. What happened in the past is deeply etched in the present. Past, present, and future commingle. Stories do the work of ordering and connecting, and imperfectly so in the case of a rupture, such as cancer. Beyond temporality, I raised in the talk the issue of audiences, real and imagined, that shape narrative. It may seem as if we are listening to, quote, the whole story, but it is only a story, selected from fluid possibilities and profoundly shaped by audience. Narrative researchers who work with letters, diaries, and autobiographies face the conundrum of audience all the time. No document is purely personal and subjective. The social world and various imagined audiences enter in countless ways. When working with interviews, it is easier to see the presence of the questioner-listener. When working with language and written documents, the shaping presence of others is more difficult to identify and interpret. All personal narratives contain gaps, and analytic readers should wonder what they might signify. In my illness narrative, the biggest gaps related to audience are my emotions during the ordeal and the place of friends and family. Because of the professional setting of the talk, I chose to minimize disclosure of emotional dimensions. I also see now that the absence of my emotions produced this smooth, somewhat settled and subdued illness narrative. Believe me, it differs from the flow of my experience and even from what I chronicled in the Cancer Journal. At the same time, I can honestly say I didn't spend a lot of time with my feelings during the ordeal. I was too busy getting my leg to work and assuring others I was going to be all right. On a lighter note, I left out some funny things. You may remember that I began my writing by juxtaposing a gym workout and packing a suitcase for the hospital. I did work out at the gym that day and carefully packed a suitcase when I got home, but the suitcase got left at the top of the stairs. Inadvertently, it never made it into the car or to the hospital. How might we interpret that? I close by returning to the dilemma with which I began, searching for a form that would enable me to explore complexities of time and audience. Could this cancer survivor, who also happens to be a narrative researcher, write a talk based on her journal in a form that was instructive? I was not writing to help other cancer survivors. I wrote about my illness to get through it and to open up issues for others working in the narrative traditions and medical sociology. Only you can decide whether the goal was achieved. So, how should we work this?
Yeah.
Well, I think that you should have to take questions. You want to
Yeah.
Yes, I was going to say, quite difficult to take questions if
Yes.
it's not your paper, but comments are welcome.
Yes, I'd just like to comment on my research is about interviewing partners of people with terminally ill with cancer. And the issue of temporality has just been there so much during the whole thing, both from the point of view of time shrinking and expanding in this period, but also in the need that some of my participants have had to do what I've sort of called a blow-by-blow account. And in giving me the blow-by-blow account at the beginning of the interview, they were somehow trying to make sense of and trying to bring order to something that's been really chaotic and continues to be so. But it was very notable that the importance to them of trying to get it right and going back and correcting themselves and saying, no, actually that happened first. Of just trying to contain it somehow and make it maybe more manageable.
Anybody else?
Well, can I just say thank you to you for reading that, because it's very hard to listen to, never mind to read, and at the same time so rich, you know, so full of things that are central to narrative theory, that are written lightly, you know, so you couldn't pass over them, but that are really densely theoretical. But, you know, over all that, I think that it was extremely difficult to read, but I'm really pleased that you could. So, I mean, that's, I'm saying that in parentheses, I'm not cutting off discussion.
Yeah,
but just
I guess one of the things I would think, I mean, you know, I guess one of the things, for those of us who know and love Kathy, one of the things that's been most moving in the last 2 weeks was actually seeing her. A lot of us were at a conference in Paris just over a week ago, and just seeing her going full guns, and so it's really quite disappointing. But she, you know, that she isn't here. But actually, you know, she's just so. I mean, I think there's so much of her that just really resonates out of these pages. And she was really, you know, she was very clear this morning. Told them it's a pesky bug that's got me and I'm fine. You know?
Yeah.
So there's this constant, but I do think that what she has done there, I mean, Anne and I stayed up quite late talking about it last night, you know, I think that hopefully we'll be able to bring it out together, but there's so many, although in some ways, you know, a cancer narrative, an illness narrative is quite really to the side of what we're doing, habitual family practices narrative. On the other hand, the core issues that she's raising, I think, are, you know, we've seen really throughout the presentations this morning, and actually anybody who's thinking about narrative research, you know, these are questions for all of us. I think it's really, really rich.
What I thought was really hanging on to every word, because she was storytelling her experience. At the same time, I felt like she was informing. There were so many things happening with what she had to say, but her talent in storytelling just kind of brought me. And the other thing, I mean, I'm American, and I think a lot of times in our culture we don't consider the cancer narrative as part of life. And you know, I do think, like, in some cultures, family, children take care of their parents, and that's a given that comes out in those narratives, whereas in our culture, it's sort of severed and put to the side. And in a way, I felt like what she was doing was asking me to look at it and put it in the center.
Yes, yes.
And I thought it was just incredible and fascinating, and I'm so glad you shared it.
Can I say one thing I should have said, and is that one of the things, she was so disappointed not to give this, and we can see now what a beautiful paper she has written for this occasion. So she really wants to hear people's reactions, and one of the things we are going to do at the end of today is feedback your reactions. But I would also really warmly encourage you to, you know, if you feel it, to write to her as well, because she really just wanted to know what do people make of it, you know. And so I would encourage you to think.
Yes, maybe at the back.
Yeah, just following on from your comment, I think one of the things that I was trying to think about constantly as we were reading the paper was the link to the everyday. And the word of rupture or trauma as being antithetical to what we think of as quotidian or everyday. I think what's very powerful about the account is to cause us to think about the horizon of death in life. That in every small kind of everyday practice, that illness is present in the well. And I found that really quite provocative.
Yes, it's lady in front.
Me.
Yeah.
I was just, this is a slightly looking forward rather than looking at that particular piece, which is, I would love her to do a journal about Lyme disease. Because it's a very different condition, and in particular because we do have cancer narratives, which her story is fitting into, and we have a very different set of narratives around Lyme. And I find it very interesting that she's saying this is just a bug, this is fine, which in itself is giving us a story that we need to take away from that. And yeah, I would be very interested to know whether she's able to reflect on her experience of Lyme, the differences between the two kinds of condition.
So I noticed the use that she made of the kingdom of the healthy and the kingdom of the ill, and the passport, and the allowing the transition between without destroying the sense of self. So she retained the sense of self and moved into those places and back again, and also knowing that that passport that she has is going to be used in the future as well. And it does not take away from who she is. She also mentioned in there that her sense of self as an academic being was being provoked for her to write about it, and challenged her sense of self as someone with relationships, how other people were going to read her story of herself.
Yes, I think you're right, and I think we need to really pay close attention to that title, Writing to Get Through It.
Yes.
Yeah,
But it's also part of it that, I mean, if we take the notion of the passport, I mean, that in itself is still a book. It's a story of the self as well. The movement from place to place, not just the geographic place, but the self place, the imagined place, the future place.
Anything else anybody wants to?
It just a reflection really, it struck me that it's absolutely about the everyday, because what the journal does is see how you fold the extraordinary into the everyday. And it reminded me of having a conversation with you about your work around Berlin Wall, and you saying that this is about everyday life, because that event was in their everyday life. It's not, we don't move outside of everyday life. Everyday life really is everything, because everything happens within it. So.
Thank you. Yes, I agree totally. I think, yeah.
Thought you might.
Really? That sounds like something like that. Okay. Well, I mean, I don't know if there's anything. Would anybody else like? I mean, I and indeed hopefully others will also feedback stuff to her. But these are really rich comments, and she would love them.
One question.
Yeah.
So one of the things I'm interested in is what reading aloud does. And obviously, if Cathy read this aloud, it would have been Cathy reading aloud her own words. But you've read aloud Cathy's words. I just wondered if you had thought about. Clearly, it was quite effective, in terms of people touch people and was moving. But any thoughts you have about reading aloud and a narrative? So the notion of performing a narrative or bringing it into a room.
That's a really great question. Yes, I do. Well, if I could take a minute actually to talk about that, because one, just to limit it to this paper, reading this paper aloud, I think it probably comes across. I and I'm sure everybody here, but I'm really, really disappointed Kat can't do this. She's been writing to me, and I'm sure to others, about how excited she was to be here, and about, I knew when she was keeping this journal, then I knew that she had decided to, it was this whole thing, and really, literally up until last night, she was coming here. 2 days ago, half the people in this room were at an event with her in London. I mean, so that's tough. And Anne gave me the honor of, she said, would you read that? And I was really happy to do it. But it's mixed emotionally, because I want her to do it. On the other hand, so I wrote to her last night. I wrote her a letter about what it meant. First of all, I hadn't read her paper. She didn't want me to read it. She said, wait till you see that paper. You're not going to believe it. And blah, blah. So Anne and I read it together last night, and it was really important, I felt, for us to do it together. We were doing it together also structurally, like how are we going to present this? Okay, but it was also a close bond reading this together, and and I have to say that we actually cut about half of it. okay? It was a lot longer, almost twice as long. So we were trying to create a certain kind of thing that I could be more me in. So there's a whole level of that, of also, I'm not this person, but I am also a person who has that passport. We are all, gonna track. I haven't had that experience, but I know that she had been through, but by articulating it, it is as if it is your own. A related story, which really, I was telling Anne last night, a couple of years ago, there was an event that CNR put on at the British Library, in which Denise Riley was going to be reading from her extraordinary book, actually, Louise, related to your book, to your work, to your comment about time. Denise wrote a book, which I forget what it was called, Time Flows Through It or something, but it was about the losing of her son, and it was about what does it mean to be a parent of a dead child, not child, adult child. And this, I mean, again, it was something which came, Maria Tambuku, my colleague, was organizing this event, and she said to me the night before, Denise is sick, can you read this? And I was like, yeah, sure, of course I'll do anything, and I'll pick up, juice, and I'll get it. No idea what she was actually talking about. And I read this, and she's one of the most extraordinary writers. And I had to perform this talk about this loss in front of everybody, and I have to say, I was able to do it, but the cost, not cost, I was happy to do it, but what it meant to me to do it, I just had to leave. I couldn't even be, it was like a whole thing. The funny thing is my sister's an actress, so I talked to her about this later. I said, I had to be this other person, and it's not my kids, it's not my child who's died, but at that moment it is my child who's died. You have to articulate that. And you have to allow yourself to have it. So, it wasn't quite as tough on this one, but it was still thinking, what did it mean for Kathy to write that and for me to be that ventriloquist?
It also gives us an insight into what narrative carries as well.
Yeah.
If that's possible, for it to invoke those kinds of feelings.
Yeah. But I felt like we'll feed back to her this many wonderful rich comments. And
so let's say a very big thank you.